there is no real good science out there about which foods you should eat at what times. What I'm telling you is just based on my personal experience. I recommend a lower sugar diet when you are intermittent fasting because the roller coaster of eating high carbohydrate, high sugar diet is going to make it much harder for you to fast. So you'll always be on the cycle of energy right after you eat and then a crash a few hours later. And if you're someone who's having trouble doing an intermittent fast, even 12 hours, what you need to look at is your baseline sugar. Go back and change. Write down all of your food on MyFitnessPal and see how much sugar you're getting in and go half that. So if, for example, you're getting about 120 grams a day of sugar, you want to go to 60 grams of sugar, and you will, after about a week or two, you'll be able to tolerate an intermittent fast. When you're talking about seasonal fruits like mangoes and lychee, for example, summer fruits, I absolutely think that they can be a part of a healthy diet. Fruits have lots of fiber that, white sugar does not. And as long as you're eating it within your eating window, I recommend most of your food intake to be between 12 p.m. and 5 p.m. And that's just based on circadian biology. We're trying to optimize your digestion, your food intake when your digestion is strongest. So again, like I said in the talk, 80% of your genes are modulated by circadian rhythms, turned on and off, because your body cannot be doing everything all at once. So your cells definitely have tasks that they do at certain times of the day. So higher sugar fruits, if you take it with your meals, like mango, for example, with your lunch or with your early dinner between 12 and 5, that would be my recommendation. So that's that. I know Jenda, she asked it a couple of times, so I'm glad that we got that in. Breastfeeding and pregnancy. Here's the problem. We don't have a lot of data on breastfeeding and pregnancy. And, I have 2 kids myself. Would I ever put my children at risk, for something like intermittent fasting? I wouldn't do something new. If you're someone who is used to longer fasts and then you want to just do a 12-hour fast, that would be okay. I really think that you need to work with your practitioner, though, your OBGYN, your primary care doctor, a doctor that you're working with, so that you can ensure that your breastfeeding, your breast milk supply does not drop. And if you're pregnant, I really don't recommend doing it unless you're really working closely with a practitioner, because you really don't want to do things that are going to jeopardize the child at all, even though we really don't have data that it will. I'm just saying that presumptively we want to err on the side of caution when it comes to pregnancy and breastfeeding. So awesome questions. Let me see the other questions. Yes, Preeti, this is going to be posted on YouTube, and Dr. Lena will let you know where that is. Intermittent fasting is actually really, really great for PCOS. PCOS is a high insulin state, and intermittent fasting, one of the best things it's good at is reducing your insulin levels. Dia says, to break a fast, would you recommend water, lemon water juice, or celery juice? To break your fast, you really want to choose something that is healthy and lower sugar and smaller. Like if you're just started fasting and then you break your fast with a huge meal, you're going to have a stomach ache. You're going to feel sluggish. You really want to start with a very small meal. For example, I'll have chai and a bunch of nuts, and then I'll wait about 15, 20, even 30 minutes, and then have my meal. For me, that's usually chai and nuts to break the fast, and then about 30 minutes later, I have berries, and I'll have something with protein in it, with tofu scramble, whether it be, if I'm on the run, it might be a shake or a bar. It may be a chia seed bowl, and I usually have that at 10 o'clock. So 10 a.m., usually because I start fasting at about 7 p.m. So 7 p.m. to 10 a.m. is about 15-hour fast. And so what I was saying on the video is I like to go start people on 12-hour fast and then have them move up as they feel fit, and then really try to base it on circadian rhythm. So you're not eating 2 to 3 hours before bed, and then you're not eating first thing in the morning, maybe waiting an hour or two after your workout, a fasted workout. But that's all subject to your own schedule and your own body. This is not something that is set in stone and that you cannot make your own. So that being said, you do you. So then I have a question about, what about intermittent fasting? Radhika says, what about intermittent fasting for people who have GI issues like gastritis? Great question, Radhika. So it is very difficult in the beginning for some people who have very, very severe gastritis or reflux. You may feel a uptick on it when you start to fast. So I would just go very slow on your fasting interval. So you may want to fast just 12 hours and see how you feel. And you may even have to go to 11 hours or 10 hours, really short fasting windows to start to let your body get adjusted. And over about 2 weeks' time, you will notice that you have less symptoms. So what I do is tell people to start with 12 hours. You might not even do 12 hours every day. Just start really easy and slow and let your body get used to it. Great questions. I have a couple more. These are awesome questions, guys. So Jayanti says, I have prediabetes and found that a 14-hour fast works. Beyond 14 hours, I notice my morning sugars get too high. Great point. That is probably a response your body has. After you use your blood sugar, you actually go to your liver sugar stores to release the liver sugar stores. So some people will find that after exercise or after fasting for a longer period of time, their sugars shoot up. But that is something that you can slowly increase over time. And again, make sure, if you have diabetes, make sure you're working with a practitioner on that. KP says, what's the least amount of time to really qualify as IF? There's really no particular time. I would say that intermittent fasting for me starts at about 11, 12 hours, and it ends at about 24 hours. Once you're at 24 hours, you're considering it a longer fast. And then why sunlight prior to 10 a.m. is more beneficial? Well, what I was trying to say, Jayanti, is that there's a good amount of research coming out on circadian rhythms. And what they say is circadian rhythms is not just our sleep-wake cycle. We have actually clocks in every one of our cells. And we have timers, and everything's based on a 24-hour cycle. So, for example, when you get light exposure in the morning, natural light, so nature, blue light, not blue light, natural light, sunlight in the morning, it tells your brain and the cells of your body that it is morning. And it helps regulate the genetic mechanisms that are meant to go on in the morning and the evening. So like I said, 80% of our genes are modulated by this light-dark cycle. And believe it or not, even if you removed your eye sensors from light, your body will still know it's daytime. So we know that there are sensors other than our eyes that can tell light. So there are many, I just say before 10 o'clock, I mean in the morning time, at some point, early in the morning, mid-morning, but at least by 10 a.m., get some morning sunlight, get those mechanisms going, and then stop eating about 2-3 hours before bed, turn off those blue lights, and do the opposite mechanism, start the dark mechanism, the rest, the repair, the mechanisms that work well at night can get turned on if you do that. A couple more questions. Thank you guys so much for being here. This has been so amazing. So many amazing speakers. My colleagues are so smart and they're so entertaining. Stephanie says, when's the best time to, in your menstrual cycle, to try a 24-hour fast? Okay, so based on what I was telling you in the video, there is some methodology that says that in the first half of your cycle, you're more stress resilient. You're more estrogen dominant. And so you may want to try a little higher intensity workout or a higher intensity fast. What a higher intensity fast might mean is a little longer fast than what you're used to. So if you've been fasting for a while and you want to just push yourself a little bit more than that first half of the cycle, would be the time to try it. Now, what is the first half of the cycle? Day 1 of your period is considered the start of your cycle. Day 14 is considered ovulation. And so somewhere in between that time is when you want to try out something aggressive. And I think we naturally tend to do that. We naturally tend to turn things down right before our period. And then we kind of, as we get our period and recover from it after the first couple of days, we get our energy back. And that's when we naturally feel like trying more aggressive workouts and fasting also. So that's that. Thank you. They said, Katie said, great session. I talk so much about intermittent fasting on my Instagram. I answer as many questions as I can. I get hundreds of questions every day. So I'm happy to be answering some of these so we can have one place where we can talk all about this. Any other questions? It looks like we are getting to the end, and I know that there's so many other sessions coming up, so I want to give people a time for that. Any last questions? Oh, what kind of dinner? Stephanie says, what kind of dinner would be good to break a 24-hour fast? Okay, so just like I recommended with a regular intermittent fast, you don't want to break your fast with something very high in sugar, because you'll overconsume it and you'll have that crash and burn later. You don't want to have something too big because you really want to slow. If you haven't eaten anything in 24 hours, you really want to ease your digestion back in. So something like berries, something like a tea or a coffee or something that's really easy on your stomach would be the first thing. And then wait about 15, 20, 30 minutes before you have your full meal. And a high fiber vegetable-based meal is what I always recommend. Last couple. Let's see. Do you recommend, I asked in IVF treatment, Vani, great question. You know, that's a great question that I don't have the answer to. I don't see why you could not, but that's a question to definitely discuss with your fertility doctor. And the last question I'll take is, how do you pack in all the protein in that 8-hour window? So in America, we overconsume protein. You know, we put such a big emphasis on protein. When you look at fasting, it's actually, the benefits are taking down that protein. Low protein state can turn on a lot of beneficial mechanisms in our body. So there is actually kind of like a push and pull, meaning that protein is pro-growth. And pro-growth is great, growth of muscle, but it's also growth of cancer. It can be growth of negative glucose. It can be growth. Growth is not necessarily a good thing all the time. We also want repair, and repair autophagy and all these mechanisms that we turn on with fasting is actually a low protein state. So why am I telling you this? Is that I think we focus too much on protein in our culture. In fact, if you're eating a whole foods, non-processed diet filled with nuts and seeds and beans and vegetables, you're going to be fine with protein. You don't need to focus on it so much, especially when you're an adult. Okay, awesome. Oh my gosh, 2 more questions and then we'll get. I'll have Rupa post the name of that book. Merceline says, is agave syrup a good substitute for chai instead of sugar? I'm not a fan of agave syrup. Agave syrup is high glycemic. It's very similar, metabolized very similarly to sugar. I think it's gotten a halo effect. Honey, agave, any kind of concentrated natural sugars is not going to be as healthy as eating the fruit itself. So if you're doing chai, try no sugar, try stevia, you can try monk fruit, but would not recommend honey or agave instead of sugar. It's very similar to sugar. So hopefully that helps. And I am so happy. Thank you so much for being a part of the session. I'm so happy. My name is Dr. Amy Shah, or Ami Shah, and I had a pleasure being here. I want to give a special shout out to Reena Malik, Dr. Malik. She is a rock star and has put in so much of her time, as have a lot of the other doctors, but she's really, really put in a lot of her personal time in helping all of us put this together. I hope you enjoy it. I hope you come and say hi to me on Instagram. That's where I kind of hang out a lot at. at Fasting MD. And Rena, I'll give it over to you now if you are available. So thank you, everyone. And Alina, thank you so much. I will talk to you guys soon. Take care.